All right, everybody, welcome back to Health Made Easy. I'm your host, Dr. Jason Jones, and I'm super excited for our guest today. We have Miss Elizabeth Harris, and we're going to be covering a topic that we have never touched on, not in an interview form anyway. I've definitely talked about it on the podcast, and that is America's overdose on psych meds. Why psych meds are being used to treat physical ailments and why it has to be stopped. So, Elizabeth, welcome to the podcast. I know you have a book, best-selling Amazon bestseller. But I also know that many of our people may not know who you are. So if you could just introduce yourself, tell us a little bit about your backstory, how you got to where you are, and then we'll get right into the material.
Oh, absolutely. Thank you so much for having me on. I'm Elizabeth Harris, and I come from a very science background. I have biology, chemistry degrees, and strong interest in medicine and mostly physical fitness. Got my master's in American College of Sports Medicine, or the equivalent thereof, back, 90s. And then went to work at a local gym, nutrition center, and just grew that business, and then realized how much I just love business. Ended up buying that facility from the owners, opening a second location down here in Nashville. And then I just grew it. And it was awesome because I could do whatever I wanted to do. And I was so passionate about science. So I dug into all the things in the spa world, because physical fitness, cellulite reduction, body contouring, but it wasn't just a normal spa either. I mean, we had devices from all over the world, and I really enjoyed traveling and looking at the different science and things. And so at the point in time when my son became sick, I was just knee deep into rewriting the theory of cellulite, because there's these two researchers and I think they're both kind of right. So that's where my head was when this all started. I was writing manuals. I mean, I was like invented my own cellulite reduction device. And so I was kind of in that place where I had owned the spa for 20 years. And I had also been in weight loss. And so I'd been one-on-one with clients discussing subject matter that would ultimately be relevant to me figuring out, hey, there is something really wrong. It's not like I just, woke up one day and thought, oh, maybe this is it. But, over the years, we worked specifically with, congestion in the thighs and weight loss and metabolism. And the math just wasn't adding up the way that it used to seem to. And so I'd have a lot of clients with, lymph nodes I could tell were swollen. And then they would go to the doctor and come back and be like, oh, that's normal, or something. They told me this. And I'm just sitting there the whole time because I'm not commenting on it at that point in time. But I'm just like, none of this makes any sense, And I'm like, it's a swollen lymph node. That's an infection. I mean, these are just like the rules of science,
Yeah.
And so that's how I kind of but what was I going to do about it at that point? And I didn't really have a need to do anything about it until 2010. Well, actually 2008. I was going through a divorce. The business was so busy. So much stress. And so my hands were tingling. Like, I'd wake up, tingling hands. And I thought maybe carpal tunnel, because I would work a lot.
Yeah.
Or stress of carrying things through airports, because I did trade shows and had to lug equipment. And it was hard. But they would started to stay numb for like an hour in the morning before they'd finally wake up. And so I started thinking carpal tunnel-ish, but it was not life-threatening, no big deal, just move on. That would be the first sign of what was to come. A couple of years later, my son came down with strep throat. It was an odd onset too, because it was presented as stomach pain and throwing up. And then 2 weeks later, within the course of 3 days, had an acute onset. Well, now I know it was an acute onset of PANDAS. It's called pediatric autoimmune neuropsychiatric disorders associated with streptococcal infections.
Whoa.
Well, and I didn't realize at the time that Vanderbilt was not in agreement with it or didn't understand it. I honestly thought, because the pediatrician said, this sounds like an acute onset of blah, blah, blah. And I was like, what's that? And I look it up real quick and I'm like, oh, I immediately got it because it's similar to rheumatic heart, same theory, like molecular mimicry. And so, but I thought, oh no, that these antibodies are mistaking his brain tissue, for strep and attacking them. And over the course of 3 days, he has gone from okay, just like a little, maybe a little sick, maybe not really as much, to thinking bugs were crawling on him, thinking people were looking in the window. I had him crouching down in the corner, pupils huge. I mean, built this massive tent like for 10 hours, in an odd way, making sure that every single space of air was covered. There was not anything could be exposed. I mean, it was just like, you can tell when your kid's building a tent, but this is not like a regular tent.
Yeah.
And so took him to the hospital, not understanding. I mean, I don't think I'd ever gone to the doctor myself personally because it was super healthy. I mean, I worked out all the time. I was riding the Precourt for an hour the day I gave birth to my son. I mean, we didn't drink or smoke, and we ate well. So, I mean, I never got sick or what I perceived as was sick. And so I didn't understand that when you went into their emergency department, all the people were coming at you. It was almost like an interrogation, if you will. And they're looking for information, and what you say is so important, and you have to be so strategic. I mean, and when you're in an emergency like that, you don't want to be thinking about who you say what to and what they're going to write in the records,
Absolutely.
because psych comes in over here, but they have a white coat, and neurology comes in over here, they have a white coat. Honestly, I didn't really know there's so many different things going on, like these people, and so they ended up admitting him. And while he was there, now I would have to, 3 years later, when things are just unbelievably horrible in our lives, I would have to go pull his baby records, because I was like, you know what, this is, and I would read his whole legal medical record, and I would learn that at that point in time in the hospital, not only did he have strep still, so somehow that strep was resistant to the antibiotics he'd already had, but he also simultaneously had pneumonia. And I would learn from the pediatrician also, when I went and got his medical record from there, all the visits, that he had pneumonia simultaneously with the strep 3 weeks earlier. That would really help me figure things out later. But anyway, we were discharged 3 days later, and only, because my mom was a therapist and knew about, because she used to be in therapy, and she actually, the psych med craze really kicked into gear in the 90s.
Yeah.
I mean, it like just went from 0 to 100. And she did them all because she had clinical depression. She ended up getting her master's degree in social work, and ended up being a therapist herself. So, I mean, I was very well versed in psych meds, probably abnormally so, just because I was raised around it. But when they discharged us and put my son on Zoloft and sent us to cognitive behavioral therapy, I said, let me see that chart. And what is he diagnosed with? Psychosis result, NOS. That's another thing, not otherwise specified. Like, nothing is specified anymore. I don't know if you know that. Nothing's specified anymore. And it's like, okay, so why did he get the psychosis? I mean, these are the questions I'm asking, and you're ready to send us out the door with Zoloft and go to a therapist?
And how old is he at this point?
At this point, he was 10.
Wow.
Barely 11. So I was just like, that literally makes no sense. I mean, for rheumatic fever, you put them on penicillin. You don't put them on psych meds.
Yeah.
You keep them from catching strep again. Like, it's a protocol that's been in place for 100 years, but nobody would give us penicillin or antibiotics. And I mean, I was this close to being the first suburban mother to hold up a pharmacy for some antibiotics. I'm going to be honest with you, because why will you not give me what he needs? Why are you forcing us to this therapist? We ended up doing 52 sessions with her because I'm paying for all this, and the Zoloft turned him into a zombie. And actually we took him off of it and he was fine. So he didn't need it. Later, I would learn that Zoloft is an immunosuppressant. So, a year later, we're working with this therapist, and by this time, everybody's got attachment disorders. I mean, we got diagnoses flying everywhere, and I'm like, because I have 2 adopted kids too, that I just adopted like 3 years earlier. And then my son got sick again, and this time I said, "Come to the house. I want you to see it." Well, then she discharged us and said she wasn't going to see us anymore for further medical rollouts. Anyway, long story short, it would go like that. He would go up and down. I mean, an onslaught of different symptoms psych symptoms with what I saw as probably it. I was just making a lot of connections. In the end, we ended up involved with, he got strep again. We got involved with the juvenile detention center. It got so bad. He ended up being in solitary confinement for 5 weeks, got PTSD. So now I've got pandas and PTSD. So I'm like the psych, I'm knee deep and okay, this is a mess. But I stayed the course and I stuck to the medical piece because I knew that if I couldn't fix that, there would not be a chance for me to even get the PTSD addressed ever.
Yeah.
Because they were going to take custody because he was running cars through buildings. I mean, it was awful.
Whoa.
Because, I mean, and if you think about it, it makes sense. And it kind of made sense that I was thinking of Old Yeller, because Old Yeller he was the sweetest dog, just like my son was so sweet.
Mm-hmm.
It's rabies. And like, it doesn't matter what you do. You could spank Old Yeller. You could put Old Yeller in jail. When you let him out, he's got rabies. He's going to bite you.
Yep.
So this is what I just started putting it all together. Did learn that by this time I had reflex. No, I'm sorry, they've changed the name, but complex regional pain syndrome. Not sure if you're familiar with that. I was supposed to be in a wheelchair and I was like, oh no, we're not doing this. And I was like, you guys, 50 doctors, Duke, Vander, everywhere. And really, literally nobody could figure it out. And I thought, I'm just going to give it a shot. Go on my own, because I'd recorded all the doctors and I'd gotten little tidbits, and I just sat down and for a couple of weeks, and I ended up figuring out where we had gotten this infection, and it was the root of both of our issues, and they presented so differently, and then also my adopted kids had started having psych symptoms, and so accompanied with a boil behind one of their ears. So anyway, long story short, I put them all on antibiotics for several years. We got better, and none of us are on psych meds anymore. But we used to be, there's probably 15 or 20 psych meds in the cabinet between all of us.
Oh my goodness.
So
Right,
it was so interesting what you said earlier was that I was in all these offices. So I'm like always in the therapist office. So I'm hearing their school of thought. Then I'm going to all these doctors and I'm hearing their school of thought, thinking these doctors have dropped the ball and these therapists are picking it up, but they don't have the tools to play the game.
Correct.
And that's exactly what is happening, because I'm sitting there and I'm like, I'm taking my daughter, the one that's adopted, to the doctor because her heart rate starts beating real fast. But with all the other stuff going on, and a boil had just come up behind her ear, oh, that's anxiety. We're going to go over here. And I'm like, don't you think we should put a heart monitor on her or something? Like, her heart is beating fast. That's not like,
yeah.
I just saw it and I was just like, my eyes were opened and I was like, this is insane. It's insane. And so now the bottom line is most of these people, if not all of them, have some low level chronic infection or multiple infections most of the time. And then they end up on psych meds forever. And we're not allowed to have antibiotics anymore. There's the crux of it.
Whoa. Okay. So now, is it not allowed to have them because you've done them so long they're going to be ineffective, or?
No, I'm saying as a country, we're not allowed to have them. I mean,
Gotcha.
it's a mandate. The federal funding for this antibiotic, I mean, there's some name for it now, to where like they get federal funding if they don't give out antibiotics. So like, it is like ridiculous that it's a movement that's bigger than you or I.
Right.
It was a business plan. Very well thought out.
Makes sense. I mean, I think if it's, I think over the last couple of years, I can't imagine anybody's going to be in the middle. I mean, I think there's some people in the middle, but then you have people who are over here that are, fully bought into everything that they're told. Then you have the other people, who are on the other side that, can think relatively clearly on health related issues. And like yourself, when you've been in the health field for as long as you were in it, are in it, I've been in it for over 20 years. There's a rhythm, there's a system, there are steps that you take, and like taking good histories, doing proper evaluations, running tests, all these kinds of things, which seems like, a lot of that was just sort of jumped over, when they were taking care of your son. So if we've got all these people, who are on psych meds, and if they've got some, the infections, and they're creating sort of these psychological, or things that appear to be psychological, whether they are or they aren't, I'm not sure. What do you think is really like, if from all of your research and everything that you've done, sort of like these rise in psychological issues over the last number of years? Is it that there's a rise in infections? Are there one of those things where we're looking for it more, so now we see it, type of a deal? What's your thought on it?
I'm glad you asked that question, because, I look that line of reasoning, just, it doesn't make any sense at all. I mean, I remember being in 7th grade, 8th grade, 9th grade, 3rd grade, looking around. It doesn't matter if we knew what autism was or if we were able to diagnose it. We would have seen in our class.
It didn't exist.
But it was not there. You will never. And it's like, when somebody says that, it just makes me want to be like, whatever. So rule that out. Okay.
Yeah.
Now, the next thing is that I had the same questions, because I'm like, my son did have lumbar puncture. We did have tons and tons of tests. So why did they not find it? So I was like, and you would truly, I met tons of doctors, and I was so mad at first, because I thought, I don't know, it just felt like everybody was against me for so long. But when I truly got to know them, I was like, they just don't know. And then I started thinking, how is that possible that they don't know? After I figured it out, we got better, and I'm like, what? So I went to medical school like last January to see for myself, and I took one class. And then I took an infectious disease class. Like, really, he let me skip all the classes to take that one. The first class I took was supposed to be biochemistry. I got in there and I was like, this is not biochemistry. This is biochemistry in a patient with cancer. Everything was upside. It was the very first class. It was a prerequisite. You had to take it. Like, why are you teaching us all these metabolic pathways under the influence of an oncogene? Because it makes everything backwards, and it makes it very convoluted and very confusing. And once I was in it, I was like, oh, I don't want to get brain. I started getting so I'd go back and review what I knew. And then I would, come back to this. And then the infectious disease class, nada, crickets, no mycoplasma. In fact, things like nothing was, the things that were tested over were just like, so nothing that really is affecting anyone. And I was just like, I called the professor and I said, I just need to ask you something before I withdraw from the school. I didn't tell him that. I was like, is the material that we were tested over in this like class, is like, that's what doctors are tested over? And he goes, yeah, these are questions. And I was just like, shaking my head, because I mean, it is like, what you're in the infectious disease class, barely any mention of creating a new antibiotic, a new antiviral, nada. You're in the cancer class. What drugs? These are the vaccines. I was just like, I mean, it hurt people say that, but I thought they don't really know. But then when I saw it for myself, I was just like, oh my gosh.
Yeah. Yeah.
Because see, then they, the insurance companies won't pay for anything that they don't approve of. So even if you find a doctor that wants to work out of the box or believe you, they can't, especially like if because the insurance won't pay for it. So I've spent years, we finally got something set up for people that, can't find help. We have a clinic now with the doctor, and we'll do Zoom and, do what we need to do to help people. But we really like to focus on the people that are in really bad shape, because there's so many out there and they're just filling up the psychiatric hospitals. Think about all these new psych disorders. I mean, just think about them as a person. Cutting 2,000 years ago, they bloodlet to release infection. Now, all of a sudden, it's emotional distress.
Yeah.
Picking these things that come on people's skin, I'm just like, I don't see how people don't see it, except for that they keep them all sequestered.
Yeah, that does make sense.
So
And it's so fascinating that you brought up, the infectious disease class, because I remember immunology, I remember biochemistry class, I remember all of those things and all of the all the energy pathways and all those things that you had to learn, like, and I hated it, every bit of it. I was like, I'll never use this type thing. That was not true. I do. But then immunology was like, you actually learned about the human immune system and what they knew at the time, and what was being in the textbooks and all those kinds of things. Now we don't prescribe drugs or do anything like that, so you're not necessarily going to learn your pharmacy, or pharmacology type stuff. But I
we
just find
learned the
that,
science.
and I'm not surprised. Yeah, you learn the science for sure. I'm not surprised by that though, because I've known for a while that medical school's bought and paid for, type of a thing. And then whoever writes the checks for the school, they get to dictate what is unfortunately taught to the students. And for those of you out there that are listening, unfortunately, that is true. It's like money talks and BS walks. So it is a sad state of affairs. I think it's terrible that so many people are on the psych meds. My question to you is, like, what's the way out? Like, when somebody is either been on them for a long time, they're being put on them. What are some alternatives that they can they can do, or are there some tests that they need to take to find out what the deeper real cause is of what's going on with them?
I mean, and that's the conundrum because, like you pointed out, I mean, I haven't mentioned where this particular organism originated from, but it has permeated our whole country and it is airborne, and literally, like autoimmune diseases, in essence, yes, they are. I mean, anybody that's in a flare up of anything, it is all the same thing. It's not always the exact same organism, but it's a combination of them. So it's just like, and that's how we continue to get worse. Like, you start off with ADHD and then you start dating someone that has, lupus, and then 9 to 18 months later, all of a sudden now you've got bipolar because you present on the left side of your ethmoid sinus. And those are where a lot of the psychiatric symptoms originate from. So it's like, you've got combinations. So it gets to be real complex. But what I always look at is, how bad is someone? Like, is it worth it? Because coming off of a psych med and doing antibiotics for like 6 months, and then you wean off psych meds, and then there's a shift. I mean, it works great. I have tons of pandas kids off psych meds. I had one 12-year-old came with clonidine, carbidopa, levodopa, 3 of Zoloft, a CPAP machine, still, he in the bed, almost 12 years old, in
Yeah.
enuresis, and wouldn't grow. Within 6 weeks off of all that, grew 4 inches. I mean, and now he's doing great in school. So it's just like, how bad is the person? And the symptom, we can tell what the organism is. So it's like, I don't, honestly, I don't know the right answer for everybody. I just know the
So
school shootings, the kids have strep 2 weeks before the school shootings. And I'm just like, I don't know what's going to happen to our country.
yeah, I'm not sure either. Now, when it comes to I guess diagnosing, I guess
Mhm.
the infection that's there,
Mhm.
are there particular tests? Are the infectious agents, are they more intracellular? Because I know things like Lyme's disease and that kind of stuff, they'll, if you don't do the test within a particular time frame, or the traditional test, you'll get a or you'll get a negative test. But then because it's gone intracellular, it kind of hides from the
Mhm.
traditional testing. So is it like traditional testing not effective, or we're doing the wrong test?
Well, you're going to have to, well, we have panels that we use, and
Okay.
IgG has got to be considered. IgG has got to be considered as probable chronic infection in these patients, rather than
Hmm.
just some, and so we run for, this common myriad. I mean, there really is a formula. I mean, it's normally going to be a combination of maybe 3 or 4 of 20 to 25 organisms. And so we'll order the panel, And then, I mean, a lot of times we'll find it, from
Yeah.
rickettsia. I mean, by blood, you can sometimes find it if you know that you're not only looking at IgM,
Right.
Then alternatively, I have a Zyto Elite, which
Yeah.
is like, and I programmed it. We look for 1,600 biostressors. So I got the big one, and I can really tell a lot from that, even though it's kind of, arduous. Nobody can, but I'm like, okay, the things that consistently are popping up, then, okay, we might have a parasite in the mix, but let's clear this first. And then the most important thing is knowing how to clear in what order, because there's usually
Yeah.
one root that's probably driving a lot of it. And then the other ones have just kind of gotten on board. And so like, sometimes you want to go straight for the root. If someone's in really bad shape and there might be in danger of dying, you got to go for the root and deal with the hercs, because that's the best. But then somebody that's not in as bad shape, you'd want to start clearing kind of extra first, and then work into where they could still function. So it's a case by case basis, but it's honestly not as hard, once you know how to do it.
Okay. And do you see, like, I know you said there's like 20 different infections that people can have. Is there like a top 5? Like, man, these are like way more common than some of the rest of them?
Yeah. Oh yeah. Mycoplasma is really common. Borrelia is common. I mean, also I have a huge symptoms checker. So I'll be like, soles of the feet, and I look back at my chart. I can share it with you one. Ehrlichia, not as common, but you should look for it. Rickettsia. There is also a lot of mycoplasma genitalium, lots of mycoplasma genitalium. And I think people get so freaked out because of STDs or whatever, because it's
Yeah.
classified as that, but it's all, think about it. And I just kept thinking to myself, our bodies are not disconnected. Like ENT, we're going to an ENT, but that's connected to our throat that we swallow, to our gut that goes in
Yeah.
our urogenital tract. So just because you've got a pathogenic strain of mycoplasma genitalium, it doesn't mean you're a bad person. It just means that the mycoplasma has migrated down, into epithelial tissues. And then now, so we look for that. And then I'll send you the list that we look for.
That'd be
And then
great. Yeah. 'Cause
yeah. And then,
I think what you just said was really profound, and I think people really need to understand that everything is connected. It's like all of like you talked about the epithelial tissue, and like all of the inner linings of all of your organs is epithelial tissue. Your skin is, things. Your skin is not some like amazing barrier that just stops everything. If nothing else, it's like a weak filter, and a lot of things go in. If it goes on your skin, a good percentage of whatever hits your skin's going in. And you can be exposed to things and pick things up in ways that you would never even think you would pick them up. Like you said, you're just like you have this psychological disorder, and then you start dating another person that has some sort of autoimmune condition, and of course you guys are going to be close a lot, and things just tend to get picked up. And I don't see it as any different than the person who is, let's say they have a terminal disease, like they have a terminal cancer or something, and the spouse, lays next to them in the bed all night long. Our bodies are not, disconnected. It's like, if nothing else, energetically, we're right next to one another. Just like if you hang out with a negative person long enough, they're going to rub off on you, just like a positive person would, from there. So when people start to, is that really the process? Test, find out exactly what it is, start to attack whatever the bacteria, virus, parasite, whatever that it may be, clear those out, and then the person starts to step down off of the psych meds, because I hear that's brutal.
yes. Yeah. And then it ends up not being brutal. I mean, it's really not brutal at all. Now, here's another path, like depending on who you're working with, is that Research Nutritionals has a fabulous nutraceuticals line. And they've got a transfer factor multi-immune and a cytoquel, which is a cytokine immunomodulator. So if you can start the patient on that and kind of balance out their immune system, because the psychiatric symptoms are just a misdirected immune response. Think about it. Instead of targeting the fever center, they're misdirected, and they're targeting the area of the brain and the amygdala with the rate. I mean, this is not that difficult of a complex of an issue to understand and I just don't understand why people aren't like able to get it, or maybe they've never been told. But I mean, transfer factor, multi-immune, and the cytokine, and then you would very slowly, depending on their psych symptoms, and then typically you can take them off a psych med at that point. And then you go in and there's L plus, like targeted transfer factors specific to the 5 strains of Lyme, and there's plasmic specific to the 18 that definitely most of the organisms that we look for are in there. Then they've got these wonderful tinctures. So that's a great, and the Zyto is good for energy. And once you know the symptoms, like you know what to do,
Yeah. Gotcha. Yeah, I think that makes sense what you said about, folks sort of not knowing what to do. And I think there's a lot to that. I think that, we've all been sort of, conditioned throughout our lifetime, that, there's really only one way to handle something. There's meds and there's this and there's that. I mean, as a chiropractor, I have the same challenge that any natural health care practitioner, when I tell people, hey, listen, your brain controls your body through your nervous system, and then when that works better, the rest of your body works better. And then it's just like, people can get that intellectually, but to own that as a truth in your life, and sort of operate from that is a whole nother thing. And I think that's where, when you live in the world that you do, it's just like, it's one thing to have the facts and the data, and for the person to understand it, on an intellectual level, but to like make the connection and go, okay, I can see how this is helping me and how this is going to work. That's a whole nother jump, but for them, but nothing speaks like results. That's kind of how it goes.
And they will, they'll see results. And it's just like, it's interesting because most of the people that are infected, well, now probably most of America is carrying at least something, but will be in your office first. That's where I went. That's where my son went, because it's either their TMJ or my trigeminal neuralgia that I didn't understand, or my complex regional pain that I thought was because I sat. And I went for 6 months, and it just wasn't like, and I'm like, okay. And then I'm just like, okay. But it would be wonderful, because that would be a perfect place for intervention. Because if my chiropractor had the information, he said, hey, this is like, it's been, 12 weeks or 12 visits. This isn't really following the normal course. Let's scan you. Let's see if there's something else. And then let's add this to it.
Yep.
That would have been, and then my son went too. So then he could have made that connection, like, oh, well, that might also be affecting her son, because so, I think chiropractor would be great place to intervene in this situation.
Absolutely. And I think and in a lot of states, we're well within our license to be able to do that kind of a thing, as long as we have the training to be able to to back up doing it. So, and I know guys that are already doing it. So yeah, I think it's great, and I'm glad that we kind of dove deep into some of these causative factors for the psychological disorders, because for the longest time, in the back of my mind, I was thinking the same thing that you were thinking, which is like, where's all this coming from? It's like, we can't just, all this stuff is new now, it just doesn't make any sense. And now it makes a whole heck of a lot more sense. And I know we were getting really short on time, so I would like to finish with a couple things. One, thank you for coming on the podcast and doing what you're doing, and truly getting to the cause of people's deep-seated issues and helping them heal from the inside out, because that's the only way out of this thing. When people are not well, is they have to heal from the inside out. And then I would like you to talk about how can people not only get in touch with you, your clinic, and maybe how to get a copy of your book. Like, what's the best way to get a hold of you?
Absolutely. My website is sound like, well, yeah, what'swrongwellness.com is the website.
Okay.
And you can go on there and you can order the book, like on there, on the homepage, there's a video playing. You can just click and order the book. But I always do recommend before someone starts treatment to read the book, because you really need to understand you'll slowly walk through how it happened. You'll make connections, and whether you have PANDAS or not, it's like I had, I don't have complex regional pain syndrome anymore, but you just need to see that part of it. And then you can reach out to us and we'll help you navigate anything. Like we don't just only take patients. We will also talk with you about trying to find someone in your area. So Elizabeth at what'swrongwellness.com. Just email me. Mm-hmm.
Awesome. And I'll put all that in the show notes so everybody can get a hold of that. Elizabeth, thank you so much for coming on today. I'm super pumped that we got connected. This has been really great.
It's been a great conversation. Thank you so much.
Absolutely. My pleasure.
Talk to you later. Bye-bye.
Yep. See you.